Hey everyone, Chris Lewis from Fox 47's Digital Newsroom. Excited to have you here again today. Today, we have Dr. Jane Turner, who is a professor in pediatrics and human development with Michigan State University. Really excited to have her here. Dr. Turner, thanks so much for joining us today.
Well, thank you for inviting me.
It is my pleasure. And, you know, I've loved having some conversations to be able to kind of clarify some things, because I know that so many things are so different right now. And I'm sure you're getting a lot of questions, especially from new parents and parents of young children, about whether you're still meeting with them or seeing patients in this time.
I do get a lot of questions. I run into families that we see in clinic. By run into, I mean we're walking on opposite sides of the street in my neighborhood, or phone calls, and they're wondering if we're still seeing patients and if we're still in operation. And I think it's very important that families know that pediatric practices are operating. Some smaller practices may have had to close temporarily because of the restrictions and small volume, but certainly at Michigan State, we are still seeing patients, but we have changed our operations when we decided no more non-essential face-to-face visits. And that means we say a 9-year-old who needs an annual checkup, say not essential right now, we can do that later, but continue to see in practice, and we continue to see in person those kids that really need to be seen. For instance, the well baby checks, the newborn visits, the 2-month-old, 4-month-old, 6-month-old, babies that need immunizations. We do not want to have a group of babies who are vulnerable to other diseases as this coronavirus goes through the community. Wouldn't it be horrible to have an outbreak of whooping cough because they didn't get their pertussis vaccine? So we are seeing those kids in person at our clinical sites. And we are seeing others by telehealth. We went a very, very rapid adoption of telehealth. So we are seeing a lot of kids by telehealth. It's amazing how much you can do using a Zoom. Now we're using at Michigan State, we're using a Zoom product that is HIPAA compliant, meaning it has high security and it is protected for privacy. So we can interact with families and look at kids over a video and really take care of most health conditions without having a face-to-face encounter. We're taking care of managing kids with chronic health conditions. A couple of the most common chronic health conditions in kids are asthma and attention deficit hyperactivity disorder, usually called ADHD. And we can, see how they're doing, talk to the child or the teen, monitor their progress, and write prescriptions electronically and take care of them without a face-to-face visit. We're also taking care of a lot of our patients, mostly teens, with depression or anxiety. We can do those assessments over the video. In addition to that, we can take care of a lot of acute illnesses. Let me give you a couple of examples. I had a child, I took one of the telehealth visits about a week ago, was a child who had hurt her wrist. She was redecorating her bedroom, and something fell and landed on her wrist. So the mother was wondering, should I go to urgent care? Do I need an x-ray? Do I need to go to the emergency room? Well, over the video, I was able to assess the wrist. I was able to look at it. I could see that it was a little bit swollen. I could see that she could move it fully. She could clench her fist. She could move everything. And we could determine that had I seen her in the clinic, I wouldn't have ordered an x-ray. We didn't need one. And that a little bit of ibuprofen, rest, and elevation would be enough. So just an example of something that typically someone would come in. We can do that using telehealth. Even taking care of kids with coughs and colds and fevers, we do that by telehealth. And then we determine if we can't get enough information over the video, that we can say, okay, let's have you come in and have a visit, and we are still seeing sick kids, but at a separate time, a different time from when we're seeing the well babies, and separated so that no one spends time in the waiting room, so that we have plenty of time to clean the rooms in between. And we ask that when people do come in, only one parent and the child comes, so we don't have a crowd coming in. We're asking families to do their best to leave other children and other family members at home. We're working very hard and have been very successful at the social distancing for those when we do need to see the kids. But my main message is, let's keep kids safe by keeping them home, keeping them, all the hand washing, wearing a mask when you go out, etc. But let's be sure that kids get the services that they need. And we're able to do that now with a very rapid turnaround, a change in our operations.
Now, if people do have appointments that are scheduled already, that have been scheduled for quite some time, or if they are questioning whether they should still come, what should they do? What is their next step?
That's a very good question, and it's been a very big challenge because people that are already scheduled, we have to reschedule them for telehealth. It's a different scheduling template. And so we're not scheduled out very far because we have had to really scramble. And we've also, to protect our healthcare providers, we have a new arrangement of who sees the patients face-to-face and who sees them by telehealth. So for instance, someone like me, I'm at risk for having complications from the coronavirus because of my age. I'm over 65, I could get very sick with it, so I'm doing only telehealth, and my colleagues who are younger are doing the face-to-face visits. That's meant that we've had to really scramble and rewrite our clinic schedules, so people should call the office. They should call, they should call, they should call. And they should call too, because then the office staff can help decide, is this appropriate for a telehealth visit? Does this need to be a face-to-face visit? And it might even be that there's a phone conversation with the doctor to help make that decision. We don't want to waste people time having a telehealth and then a face-to-face if we know that we need to go directly to face-to-face. So the message is, call the office, call the office. We have a lot of people available to answer the phones.